Society expects healthcare workers to operate exactly like, well, like our smartphones.
Oh, constantly running a dozen heavy apps on 1% battery.
Exactly, yeah. And nobody ever stops to ask if you need to plug in. It is just assumed you will keep going.
Right, which is a dangerous expectation to put on any human being, especially in medicine. And that is why today we are looking at psychiatrist Dr. Feng Cheng Carr's philosophy.
Yeah, his concept of self-care is we care,
Yeah.
right? It is such a vital deep dive for any of you healthcare professionals in Malaysia navigating these exact pressures.
Absolutely. I mean, we are on a mission today to show why prioritizing your own well-being is not some selfish act, but the actual foundation of sustainable healthcare.
Because the reality of the job is just, well, it is relentless. Picture a typical 3 a.m. ward round.
Oh, the dim lights, the monitor, alarms.
Yeah, running from those alarms to updating charts to making rapid clinical decisions. And, the noble desire to care is what brings you to this field, but that constant heavy strain slowly drains your energy.
It really does. It erodes your patience until, frankly, compassion itself starts to feel like a massive burden.
Right. But, okay, let me play devil's advocate here for a
Let's go
second.
for it.
Practically speaking, when you are on a shift and the waiting room is just literally overflowing with patients in actual acute pain, I mean, pausing for yourself feels inherently selfish, right?
It does feel that way, yeah.
So how do you justify taking a moment when someone needs you right then?
Well, it feels selfish because we are trained to always put the patient first. But you cannot serve from an empty vessel. Ignoring your own needs doesn't make you a better caregiver.
It just leads to exhaustion, I suppose.
Exactly. Exhaustion and emotional numbness. If you don't manage that stress, your nervous system stays in overdrive. You aren't actually giving that patient your best care.
You are just giving them, like, the dregs of your capacity.
Precisely. And that physical depletion doesn't just stay neatly in your head, it leaks into your physiology.
Oh, that physical leak is so real. You know how in Malaysia we might joke about patients having semua sakit syndrome, where they point to their head, their chest, and say, everything hurts?
Yeah, the everything hurts syndrome.
Right. But as healthcare workers, we get our own version of that.
Yeah.
Dr. Fang shares this story about a really hardworking pharmacist.
I remember that one, yeah.
On paper, she was totally capable, dispensing meds, answering phones, but she was carrying so much tension in her shoulders and jaw that her body was basically screaming.
Because her body was bearing the weight of all that ignored stress. So, to prevent getting to that breaking point, Dr. Fang uses this really great Pac-Man metaphor.
I love this part. So as a healthcare worker, you are constantly navigating this maze of a hospital or clinic, right?
Just dodging endless demands and, well, the ghosts.
Right, the ghosts being those negative critical thoughts in your own head. And just like Pac-Man, you desperately need to grab a self-care pellet to recharge.
Before the ghosts catch you.
Exactly.
Yeah.
But frankly, when you are dodging actual codes in the ER or managing a packed clinic, how does taking a tiny self-care pellet actually do anything?
Well, because that pellet isn't a week-long vacation to Bali,
All right.
It is simply a biological override.
Wait, what do you mean by override?
I mean taking just one single mindful breath before you open a clinic door. Doing that actually manually engages your calming nervous system. It lowers your stress levels in real time.
Oh, wow. So you aren't just calming down, you are actively preventing your own stress from spilling over onto the next patient or your colleagues.
Exactly. It completely shifts the perspective.
It really does. It means prioritizing your well-being is a vital part of sustaining compassionate healthcare, not a selfish luxury. That's such a huge takeaway.
It is, because ignoring self-care just drains your energy and eventually makes caring for others feel like a heavy burden.
Right. And on the flip side, caring for yourself wisely ensures you can sustainably support your patients, your team, and your family over time.
Exactly, over the long haul.
So here's a call to action for you today. Before your next patient interaction, or right before you walk into a meeting, just take one deliberate, mindful breath.
Check your own battery level. It takes 2 seconds to plug the smartphone in.
Perfectly said. And as you go about the rest of your shift, I want you to reflect on this. If there is no patient in front of you right now, who is the most important person to care for?